Hello, Ayla. It's so nice to have you on the show today. How are you doing?
Great. Thank you so much for having me.
Beautiful. And thank you so very much for being here. You see, I truly appreciate you. And you see, Ayla, oftentimes I love to thank my guest for two things. And I do this so often to the point where it has become my anthem. So, firstly, I want to say thank you so very much, Ayla, for investing in yourself. You see, you are on this platform right now because you did invest that in yourself. And oftentimes, Ella, I love to make reference to the amazing mango tree. You see, some couple of months back, I was on a particular road, and just by the roadside, Ella, there was this very tall, unattractive mango tree. And I use the word unattractive because the mango tree's got no mangoes on it and the leaves were all dry. So I just walked past it and I went my way. But you see, Ella, just recently I was on that same road. And this time around, a lot's changed about the mango tree, you see. The mango tree caught my attention pretty good from a distance. And immediately I got the urge to move so close to it, of which I did. And it wowed me. Because now the mango tree's got a lot of mangoes on it, beautiful green leaves, and healthy branches. And not just mangoes now, Ayla. I'm talking about ripe mangoes. It was such a lovely experience that day, and I was so excited. There is my point. The fact that you dedicated your time, energy, and resources to becoming the amazing Ayla that you are today, that alone has made it impossible for me to skip you. And that's why you got the request for me to be on the show because I was attracted to the fruit of all that you're doing, your philosophies, your journey, the impact your work is having, and how you are offering your solutions. These stuffs are beautiful. And just before I sent you that request, Ayla, I said to myself, I've got to benefit from these beautiful things Ayla is doing. And not only me now, because I don't want to be selfish, and even with the audience. And here we are today with the incredible Ayla. So thank you so very much for doing that to yourself. And secondly, thank you for saying yes to the invite. Because if you had said nope, there was nothing Elisha could do about it. Thanks so much, Ayla.
You're welcome. Happy to show up here.
Beautiful. So let's get started. You see, I am quite excited to have you on the show today, Ayla, for some reasons. Firstly, my interest in knowledge seeking. I believe in order for one to transition from a terrible situation to that of a beautiful one, Ayla, I believe it takes the application of knowledge, quality information, and not just knowledge now, but the application of it. And you see, ever since I discovered that light in the Hebrew means knowledge and darkness ignorance, I've been so keen to knowledge seeking. Why? Because I do not want to remain in the dark. So that's going to make our conversation today very important to me and even to the listeners. And the second reason why I'm excited to have the incredible Hela on the show is for the sake of the audience. You see, Hela, we live in an age where information is as abundant as grains of sand. We've got lots of information flying out there. So those folks trust me for quality, eye-opening, and very important information, of which I am totally convinced, Ayla, that our conversation is going to be insightful and impactful. So for that reason, let's get started with your introduction. Talk to us about your personal or your professional journey, because right now we are so curious. Want to know how Ayla got here? Then afterwards, I've gotten some beautiful questions for you. Okay, Ayla, over to you.
Okay, well, I from the age of 6 was fascinated with the idea that you could go out into the forest and you could take plants and trees and roots and stems and mix all this together into some kind of healing potion. So from a very young age, I was fascinated with the idea of using elements in nature to help heal people. And so I think that, looking back on it, so many of my friends in college were just taking courses and trying to figure out what they wanted to do with their lives. And I felt so blessed that from a young age, I always knew what I wanted to do, which was something having to do with medicine and something having to do with using natural things to help people heal. And so, you know, I was always on the track to do what I do, but it has evolved tremendously over the decades. And so I initially started out studying pre-med in college. I went on to study naturopathic medicine in Australia. I came back and studied Chinese medicine in America. I went on to, graduate from a Chinese medicine program. I opened up a clinic. I was in practice for about 8 years, specializing in women's health. And during that time, I sustained a number of different concussions. And so I had to figure out how to heal my own brain. And that really led me down a rabbit hole that has changed my entire life, because I discovered functional neurology and applied clinical neuroscience. And so for the last decade, I have been studying the crossroads, really, of how do you utilize natural therapies and neurological rehabilitation and pair those things together to help people heal from brain injuries and concussions. And when you injure your brain, that is one of the most complicated injuries that a person can ever have, because that's our brain houses our identity. It houses our personality. It's what allows us to be expressive and be in the world. And so when we injure that, all of a sudden, it can change someone's entire life trajectory. It can change their career. It can change their relationships. They learn real quickly who is supportive and who's willing to stick by them and who isn't. And so this is an injury that affects someone's entire life. And it requires a lot more time than I would say our standard medical system is set up for. You know, if somebody breaks an elbow, they can get by with just going and, getting
Yeah.
their arm casted, and they know that they've got an 8-week healing time, and they know that they can go to physical therapy if they need to. And it's like when you have an orthopedic injury, there's usually a much more clear-cut protocol for what is the process of healing from this. And with the brain, it's the exact opposite. There's no clear-cut protocols. Everybody has different symptoms. Everybody has different challenges. And so over the last 10 years, I've taken it upon myself to study everything I can possibly study about the brain. And there's still so much that we don't know. And so it's a very humbling process, because what I learned 5 years ago is already outdated, and there's new technology, and there's better assessment techniques, and there's better treatment options. And so this particular field requires you to always be learning, to always be humble, to always be asking questions and have curiosity. And so that's really been my journey, is constantly learning, constantly trying to help people, and really approach each individual patient from the perspective of, this is one individual who needs a very, specific treatment plan that's unique to them and them only. So that's really what I'm doing in the world right now, is helping people to heal from concussions and from lingering post-concussion syndrome. In addition to, I do treat other people with neurological disorders, people with strokes, or people have had to have brain tumors removed and still have neurological symptoms after that. But yeah, that's really my mission, is to help those people and to get information out into the world for other people who are trying to figure out, what do I do next? How do I navigate this process?
This is so beautiful, Ayla. I tell you. And the fact that you discovered what your purpose is at a very young age, I tell you, that's really not common, because a lot of people would, go through this, go through that before they finally discover who they really are. And the fact that you're just so intelligent at doing this stuff, while you were speaking, I was like, wow. Wow, wow, wow. I tell you. These are beautiful stuff. So I am so curious. All right, let us start first with the part where you mentioned concussion. So what really happens to the brain after a concussion?
Yeah, well, we call it an acceleration deceleration injury because somebody doesn't even have to necessarily have their head hit. They could have an impact to their body that causes their head to move in a way where the brain is accelerating and then it's decelerating. And when the brain does that, it rotates. And the rotational injury can cause damage to many different areas of the brain. So it's really important to recognize that a lot of my patients will come in, they'll say, well, I hit my head right here. So does that mean that that is what is injured? And it's like, well, not necessarily. It's the entire brain that has suffered from this injury where your brain rapidly accelerated and then stopped. And so people can come in with a whole host of symptoms. And so, because this is so complex, I ended up writing a book to really outline how people can look at concussions and understand their symptoms more. So, some people can really suffer from bad post-traumatic headaches. And usually there's a neck component because when people have enough of force to cause a concussion, usually that also causes some trauma to the neck. And trauma to the neck can mimic a lot of the same symptoms of a concussion, like dizziness, nausea, even blurry vision. And so many people need to undergo therapy for both their neck and the concussion. And then people can have cognitive symptoms. And so I think that even if somebody has a concussion and they can walk away from it, what many people discover is that over the next several months, they start to feel like it's harder to concentrate, it's harder to focus, it's harder to take on the stresses of life. And everything just feels like it creates more of a sense of anxiety and overwhelm and frustration. And people can also lose their calmness or what we might call impulse control. I hear mothers often say after their concussion that they just don't have the patience anymore for their screaming children, or they get irritated more quickly at their kids and then they feel guilty about it. And so it can set up just a lot of challenges for people. And then they can also have sleep dysregulation. And sleep is so important for the brain to heal every single night that when you start to have sleep problems, it becomes a vicious cycle in terms of not even allowing the brain to get into a state where it can heal and recover. And people often also have problems with their visual system. They can have light sensitivity. They can have difficulty looking at
Wow.
screens, for example. They can have vestibular issues where they've got balance issues or just a sense of being disconnected from their environment, maybe not feeling like they can trust their balance, maybe a sensation of like rocking or swaying. And then the autonomic nervous system can become dysregulated. And so then some people will have issues with not being able to exercise because as soon as they try to exercise,
Mm-hmm.
they get a headache or nausea or dizziness or they don't feel good. And so every single person comes in with their own unique set of symptoms based on how their brain is affected.
Wow. I never knew that. So while you were talking, you mentioned something. You said trauma to the neck. Can you talk to us more about that? That sounds pretty new to me.
I didn't catch what you
Okay,
said.
okay. I said you mentioned trauma to the neck. I'm not sure.
Oh,
Yeah, yeah. I said, what does that really mean?
well, our neck plays a very important role in telling the brain where our head is in space. And
Mm,
so brain devotes a lot of resources to understanding how we are positioned in the world. And our brain wants to know exactly how our head is moving and at what speed and what velocity and different positions. And so when people have a concussion, there's often trauma to the neck as part of maybe the whiplash effect that occurs. And so people can have damage to the ligaments in the neck and they can have issues
oh,
with the discs. And so when you have trauma to the neck, it affects what's called proprioception. It affects the communication between the neck and the brain. And so I always tell people to think of it a little bit like a math equation, where if our brain really needs to know where we are in the world and how we're moving through the world, it's using our visual system, it's using the vestibular information from our inner ear, and it's using information from our neck.
Man.
And all of those three systems, when they're working perfectly, means that our brain knows exactly where we are in space. It's kind of like I had when I first got my kitten, she was running across the deck and she hit a patch of ice, and I watched her literally slip off the deck and fall off the deck. And so we know that cats can like jump out of, ninth story windows and somehow somersault through the air and land on their feet and run away, right? And so the cats can do that because they know where they are in space. And they have this amazing ability to flip through the air and land on their feet, much like Simone Biles, right? A gymnast that can, do these incredible, amazing things and still land on their feet. So our brain really needs to know where we are at all times. And when those signals get interrupted because of a concussion, all of a sudden, our brain has what's called a sensory mismatch. And the visual system and maybe the neck are telling the brain two different things. And so all of a sudden, that sensory mismatch creates a moment where the brain says, I don't know where I am in the world. And all of a sudden, people can feel dizziness. They can feel off balance. They can start to not trust their own movements. And so many people, when they come into my clinic, I watch them walk down the hall and they don't move their head at all. It's almost like their head is frozen because they're afraid to move it. And people can walk very stiffly. And so there's a lot of emphasis that needs to go into assessing the neck, and both helping the neck and the concussion at the same time because they're so closely related.
Wow. I never knew that, you see. Thank you so very much for sharing that. Okay, so while you were talking earlier, you mentioned that you wrote a book. Okay, so what inspired, the book, and how did you come about the title?
Well, because I spend a lot of time with my patients, people aren't coming to see me for a 7 to 15 minute consult, right? When they come in, I'm working with them for a full hour, sometimes an hour and a half as part of our therapy. And so I spend a lot of time with each individual patient, which means that I can't see very many people in a week. And after doing this work for 10 years, I often found that I was giving the same exact information to different patients that came in. And when you have a concussion, oftentimes your memory is not great. And so I'd tell people things and then they'd immediately forget, right? And they'd say, oh, you told me something, but I completely forgot. Or I wanted to tell my other therapist what you said, but I forgot. And so I started to realize it would be so nice if I just could put all of this educational content in writing and have it in a book format for people. Because many people after a concussion, they're highly symptomatic, but they don't always understand what's going on in their own bodies because, the average person going through school, we don't learn about brain injuries, right? That's not
Right,
part of our educational
right.
curriculum. And so when the nervous system isn't working correctly, when the brain isn't working correctly, people can become very anxious because they don't understand what's happening. And when you can provide people with information on how the system is wired and why a concussion might cause somebody to feel like they're floating when they're walking down the hallway or whatever their symptom might be, it relieves their anxiety. And so I started to realize that one of the best gifts that I could give people is the educational piece of saying, okay, based on my exam today, here's what I'm seeing is not working correctly, and that's why you have symptom A, B, and C. And all of a sudden it's like they take a deep breath and they go, okay, so I'm not making this up. This isn't all just in my head. I'm not crazy. There is a reason for why I feel this way, and you just explained it to me. And now all of a sudden they're not so anxious. And so I really wrote the book because I wanted to help more people. I wanted to reach people outside of my clinic. I wanted to reach people all over the world to say, here is the information that's going to help you to understand what you're going through a whole lot better. And if you've reached a roadblock in medicine, if you have lost hope that you're ever going to get better, I guarantee you're going to find something in this book that gives you the next clue that's going to move you forward on your healing journey.
Wow. That's such a great one. So what is the title again?
The book is called The Concussion Breakthrough. It's holding up my microphone right here. I'm using it to hold.
That's a great one.
Yeah, so it's called The Concussion
Wow,
Breakthrough.
beautiful cover.
Thank you. And then the tagline is "Discover the missing pieces to recovery," and it's on Amazon.
Awesome, awesome. I love that. So before we go, what about this one? How can we keep our brains healthy, long term?
Mm-hmm. Such a great question, and some of the answers are so simple. They're not any kind of, you don't need to go out and buy this pill or do something strange. Like the answers are eating a very clean whole food diet, so minimizing the exposure to pesticides, to glyphosate. I think what people don't realize is that when we're eating non-organic food that contains flour and oats, there's a large amount of glyphosate in our food supply, especially in America, because it's not regulated as strictly as it is in other countries. And so to keep the brain healthy, we have to keep our gut healthy. And keeping the gut healthy means eating organic, minimizing that exposure to glyphosate and to pesticides and other chemicals. So eating healthy whole foods, avoiding all of the chemicals in our diets that come in the form of processed foods and food coloring and food dyes and all of that stuff. And then exercise is the best way to keep our brain healthy, because that's what
Exercise.
keeps blood flow. Exercise, yeah.
Wow.
Yep. So important for getting blood flow to the brain. Exercise stimulates a hormone called BDNF, or a compound called BDNF, and that's called brain-derived neurotrophic factor. That's one of the most important compounds for keeping our brain, the individual neurons in our brain, healthy. And so we can do that by exercising. And then also constantly learning new things. We have to constantly create new pathways in our brain by learning new things, which is why there's been some incredible research looking at teaching people with Alzheimer's a new dance routine. And one of it's amazing how you can improve someone's cognitive health by just asking them to learn something new or learn how to move their body in a new way. The reality is, we need adequate hydration, a clean diet, exercise and movement, and really quality sleep and enough sleep. And that's really the most powerful recipe. And then also, like I said, learning new things. Those are really the most powerful things that we can do for our brain's longevity and brain health.
These are beautiful stuffs. To keep the brain healthy, we have to keep our gut healthy. Wow. I'll hold on to that. I'll hold on to that. So to bring this to an end, Ayla, for folks who would like to reach out to you, learn more about the beautiful stuff you're doing, or make a purchase of your wonderful book, or they have some questions to ask you, how can that be possible?
Yeah, the best way is to go to my website, which is lifeafterimpact.com. And on that website, people will find links to my podcast, which is called Life After Impact, the Concussion Recovery Podcast. I recognized that this book that I just held up is pretty thick. It makes it for a great doorstop, as well as full of valuable content. But a lot of people with concussions have difficulty with reading a big book like this. That's why I started the podcast. So I've got my podcast, Life After Impact, the Concussion Recovery Podcast. I've got my book, The Concussion Breakthrough, on Amazon. And then my clinic website is healingresponseneuro.com. And that's located in Lake Elmo, Minnesota. So those are the big kind of ways to find me and reach me, is through the website.
Beautiful. Your book is well detailed. I think it should be around 600 plus pages. Amazing, amazing. So that's gonna be the end of the show, Ala. Thank you for coming and thank you for sharing this wonderful stuff with us. It means a whole lot. Thank you.
Thank you for sharing.